I'm Dr. Jeff Glad, medical doctor and practicing integrative medicine physician in Indiana and the chief medical officer at Fullscript.
I'm Dr. Jacquelyn Burrell. I'm a naturopathic doctor. I work with underserved communities in Flint, Michigan, and I also work in an integrative practice in Burlington, Vermont.
According to CDC, chronic health conditions, including mental health, now makes up 90% of the $3.8 trillion healthcare bill annually on the United States. We have a conventional medicine system that's focused on dealing with acute illness, acute injury. But they use that same model for chronic health conditions, treating and managing a disease. Integrative medicine needs to be the breath of fresh air that comes into this system and looks at patients as a whole person, looks at root cause, uses the core values of nutrition, mindfulness, and movement to help promote health and reverse these chronic diseases or prevent them from showing up in the first place.
I think you're really speaking to the solution here. I think integrative medicine is the solution to these gaps in healthcare. Acute care, conventional medicine has its place, and it's so important in our medical system. But it's not only important to look at what is going well in the medical system, which is obvious. We need to see where can we do better? And I think that integrative medicine solves that problem. We can use the best tools that medicine has to offer from what you were describing, focusing on lifestyle, nutrition, medicine, movement, using that to create the best pillars of health for a patient, and working integratively with all different types of practitioners, from medical doctors to nurse practitioners to health coaches, naturopathic doctors, functional medicine. All of us have a spot in medicine, and I think working together is the solution.
Jacquelyn, you've been practicing in an underserved community in Flint, Michigan. Can you talk about integrative medicine's role in delivering care in the underserved communities?
Yeah, so in the practice of naturopathic medicine and integrative medicine, it's really important to remove the obstacles to cure in order to get to a state of vitality in a patient. And we remove these obstacles through addressing toxin exposure, poor diet, nutritional status, stress. And in doing so, certain communities have higher levels of these burdens than other communities. And this is the gap that's sort of missing in the practice of integrative medicine, and where there's a huge opportunity for practitioners to really begin to understand the sociology of medicine, the deeper ways in which communities interact with each other, and the ways in which we interact with the environment around us. For example, certain environmental toxins directly correlate with higher levels of certain chronic diseases. And when we begin to understand the deeper impact of how society, communities, environments, where we live, how we live affect our individual health, that's how we can really get to individualized medicine. When we really remove those obstacles to cure and understand as a practitioner what our patients are dealing with beyond their, what am I specifically eating for breakfast? What exercise did I do? We need to think a little bit broader, and that is how we can really begin to address some of these chronic illnesses.
We were talking earlier about, does integrative medicine require a fellowship or extra training? Can you share that story?
Yeah, so one thing I think about being a doctor is that lifelong learning aspect. And in the project I'm working on in Flint, Michigan, it's naturopathic doctors working with medical doctors on the ground in Flint. And in doing so, one of the key parts of integrative medicine is really having that trust and connection with the community in which you serve. It's pretty difficult to just plop into a community and just say, hey, this is what I know, now do this. You need to have those community connections. And you might not have the same exact training as the practitioner on the ground, but when you build that trust, build that connection, you can begin to share what, as we talked about earlier, that toolkit. We all have strengths. How can we share that with each other to get to the best type of medicine? For example, one of the medical doctors we're working with, we were in Flint, Michigan, and just talking, amongst ourselves about health, some conditions. We described some of the health benefits of quercetin, which is a pretty common supplement that we know about. And for her, it was a very great learning opportunity as a medical doctor to understand what some of the nutritional aspects, supplement aspects that we talk about, how can that help her individual health? And then she could see what are some of the gaps she has in training, Whereas, it's obvious that we all can, work together to have that best form of medicine.
One of the great things about integrative medicine is how collaborative it is. Yeah. The patient's integrative medicine journey does not have to start with a formally trained doctor. There are lots of providers out there that can guide that patient into the focus of health promotion, into taking care of themselves. It may be a health coach. It may be a nutritionist. It may be a social worker. It could be online content that they've read or a video that they've watched. All of these things provide the education and the foundation for that patient's journey. That's the key of integrative medicine, is it's an individual patient journey. And so that journey does not have to start in a medical office. It can start anywhere.
I think the key here really is to meet the patient where they're at. Find out where the patient is on their healing process, and then connect them to the solutions for their goals. For example, some patient may come in with something acute, they need something quick, they need something now, they have things to do. So let's get them the medicine they need. Others have time in their life to really dive deeper into those determinants of health. Using these slower mechanisms of healing, it takes time. To change your diet, to change your lifestyle, it doesn't happen overnight. And the integrative practitioner needs to sort of see that place the patient is in order to guide them safely to the place where they want to go. And I think that part of integrative medicine can happen with any practitioner. We're really describing changing the mindset of doctor-centered care to patient-centered care. Finding out what the patient needs, and as a doctor, understanding how to get them to that result. We all want the same thing, as that is to see our patients getting better, feeling better, and living a healthier life. And in doing so, not only will the patient trust you more, you'll have better adherence, you'll have better results, and the patient will feel better. And so part of the goal of integrative medicine is to really reduce that burnout as a physician and as a patient, and to increase the incidence of healthy lifestyle and reduce the incidence of chronic disease.
At Fullscript, we have 3 core principles of care. Number 1, healthcare should be preventative. Number 2, healthcare is a lifelong journey. And 3rd, that journey is best done with a provider. We know the value of that integrative medicine journey, right? The data suggests in multiple different studies, 80% of chronic disease can be prevented with a healthy lifestyle. And it's integrative medicine's role to partner with patients to guide that lifestyle.
Let's not get to that point of chronic illness to begin with. That is prevention. We don't always need to play catch up with our health. We can prevent the incidence of disease from occurring in the first place. And in doing so, we can reduce the burden of chronic illness on ourselves as patient and as a society. Everyone spends time maintaining their cars in order to prevent a catastrophe from happening. And I think this is the perfect analogy to our health. We need to spend more time with that prevention aspect in order to reduce the incidence of disease happening in the first place. And in doing so, this is where we can turn to integrative medicine as a solution and as the mindset to approaching our healthcare.
And to piggyback off of the car analogy, think about that from a cost perspective, right? The insurance world of healthcare is really based on paying for the catastrophic, right? You've got high deductibles where patients have a lot of money they're paying out of pocket for their healthcare. If they were to invest that money into themselves through an integrative medicine journey, the cost savings over time is humongous, right? 80% prevention of chronic disease. It's the chronic diseases that are going to rack up healthcare costs, both from your insurance company, but also out of your pocket. There's no doubt that our healthcare system is broken. Chronic disease continues to skyrocket, and the cost of that burden also increases. On the practitioner side, increasing amounts of burnout and large numbers of practitioners just leaving the field altogether. Integrative medicine is the answer to solve this problem. Practitioners getting back to the core roots of why they went to school in the first place, building relationships with patients, guiding their health. On the patient side, it's taking ownership of their health and learning the things that are going to impact their health best, and focusing on the core principles of medicine in the first place: movement, nutrition, mindfulness. It's integrative medicine that's going to bring us out of this broken healthcare system.